As a veteran and licensed professional, I am honored to present on the topic of post-traumatic growth, or PTG, in female veterans who have experienced military sexual trauma, known as MST. This presentation integrates scholarly research, therapeutic models, and biblical insights, aligning with the goals of adult traumatology at Liberty University. Post-traumatic growth refers to the positive psychological changes that can result from struggling with traumatic events. Tedeschi and Calhoun 2020 highlight that PTG includes increased resilience, deeper spiritual understanding, and an experienced appreciation for life. Our discussion today centers on how female veterans may experience such transformation following MST. The purpose of this presentation is to explore how PTG manifests in female veterans who have experienced MST. This involves integrating clinical research and biblical principles to provide a comprehensive framework for understanding growth after trauma. We will examine PTG and its relevance, particularly among female veterans with MST. The presentation is structured into 9 sections: an overview of PTG, a look at the population of interest, relevance, key variables, theoretical foundations, treatment options, biblical integration, gaps in literature, and concluding thoughts. PTG is defined by Tedeschi et al. 2018 as the positive transformation following trauma. Its 5 core domains include enhanced appreciation of life, improved relationships, new possibilities, increased personal strength, and spiritual change. Trauma can be a catalyst for psychological and spiritual development. Southwick et al. 2014 suggests that surviving trauma often leads individuals to reevaluate life priorities, deepen their faith, and experience profound personal transformation. Scripture supports the concept of growth through adversity. Romans chapter 5, 3-5 speaks of suffering producing perseverance and hope, while James chapter 1, 2-4 encourages believers to consider trials as an opportunity for spiritual maturity. Military sexual trauma refers to sexual assault or repeated threatening sexual harassment experienced during military service. The Department of Veterans Affairs 2024 defines it as a unique and highly prevalent issue among women in the military. Approximately 1 in 3 female veterans reports experience MST, according to Wilson et al. 2022. This high prevalence underscores the urgency for specialized trauma-informed interventions and support systems. MST far-reaching psychological consequences, including PTSD, depression, anxiety, and moral injury. These conditions often overlap, complicating recovery and requiring multifaceted therapeutic approaches. Kinsel et al. 2021. Risk factors for MST include deployment to combat zones, hierarchical rank dynamics, operational isolation, and the pervasive stigma that discourages reporting. Understanding these factors help tailor preventive and responsive interventions. Despite its impact, MST remains underrepresented in post-traumatic growth literature. Montieth et al. 2019 notes a lack of focused studies, which limits the development of evidence-based guidance for clinicians working with this population. A deeper understanding of PTG and MST survivors could significantly improve treatment outcomes. Incorporating growth-based frameworks may empower survivors, reduce symptom burden, and foster long-term well-being. There is a critical need for trauma-informed, gender-sensitive policies within the VA. Programs should be developed that specifically address the unique experiences and healing process of female veterans. Resilience plays a central role in facilitating PTG. PTG ETAL 2020 emphasized that resilience helps veterans navigate adversity and fosters the adaptive capacities needed for growth and recovery. Peer support and unit cohesion are protective factors that significantly impact healing. According to Lindert ETAL 2021, positive relationships with fellow service members can enhance recovery and reduce isolation. Effective coping strategies, especially meaning-making and religious coping, can support PTG. Park ETAL 2017 found that integrating personal faith and finding purpose after trauma were key components of healing. Eye movement desensitization and reprocessing, also known as EMDR, is a proven method for treating trauma. Shapiro 2018 highlights how EMDR helps reprocess traumatic memories and fosters post-traumatic growth by promoting adaptive cognition. Spirituality and forgiveness are central to many survivors' healing. Faith-based practices also individuals to reframe trauma, engage in compassionate self-reflections, and find peace. The Tedeschi and Calhoun PTG model identifies cognitive processing, emotional disclosure, and restructuring of core beliefs as essential for growth. This model provides a roadmap for clinicians guiding clients through recovery. Janoff Bowman's 2010 theory explains how trauma disrupts foundational worldviews. Healing involves rebuilding these assumptions to restore meaning, safety, and control in one's life. Cognitive processing therapy, CPT, facilitates PTG by challenging maladaptive beliefs and replacing them with healthier perspectives. This empowers survivors to make sense of their trauma and move forward. Evidence-based such as EMDR, CPT, and prolonged exposure, PE, are effective in reducing PTSD, their symptoms, and encouraging growth. These treatments are endorsed by the VA and DoD. Matthews and Lawrence 2022 emphasized the need for culturally sensitive treatment that respects military culture, gender dynamics, and identity. This enhances clients' trust and engagement in therapy. The VA offers programs designed to provide trauma-informed care, including gender-sensitive counseling. These programs are vital to ensuring female veterans receive respectful, tailored support. Bryan, ETAL 2020, highlights the potential of telehealth and digital tools in increasing access to trauma-informed care. This is especially beneficial for veterans in remote or underserved communities. Peer-led group therapy fosters accountability, shared experience, and validation. Veterans often find strength in community, which facilitates mutual support and the normalization of trauma responses. Programs led by chaplain and Christian counselors, often spiritually grounding and biblical healing. These interventions address moral injury and foster forgiveness and reconciliation. Faith-based virtual counseling models integrate scripture with evidence-based therapy. As noted by Sanderson 2015 and Chu 2011, such models enhance spiritual engagement and promote holistic healing. 1 Peter chapter 5, verse 10 reminds us that after suffering, God will restore and strengthen us. This biblical truth reinforces that PTG is possible through divine grace and spiritual perseverance. Psalms 34:18 and Israel 61:1-3 promises healing for the brokenhearted. These verses anchor our understanding that restoration is not only psychological but deeply spiritual. Philippians chapter 4 verses 6-7 calls us to present our anxieties to God in prayer, resulting in divine peace. This spiritual practice is a foundation for many survivors on their healing journey. There is a shortage of long-term studies on PTG and MST survivors. Future research should focus on tracking outcomes over time to better understand the durability of growth. Recent VA policy revisions increasingly support trauma-informed, gender-responsive care. These advancements mark a systemic shift toward proactive and holistic recovery frameworks. There remains a significant need for gender-specific research. Data focused on female veterans will allow for tailored treatment, interventions, and greater understanding of gendered trauma responses. There are several gaps that are found in faith integration gaps. Interventions remained underreported in MST care. In conclusion, PTG is attainable with the right blend of resilience, supportive relationships, and spiritual integration. Survivors benefit from both clinical and faith-based interventions tailored to their unique experiences. This topic challenges both clinicians and ministry leaders to collaborate. As integrated approach ensures survivors receive comprehensive care that address psychological, emotional, and spiritual wounds, we will continue to see improvements. Future research should emphasize longitudinal designs, cross-cultural perspectives, and gender-specific analysis. These approaches will deepen our understanding of what promotes sustainable growth post-trauma. Let us advocate for evidence-based spiritual informed programs that support female veterans by bridging clinical science and faith. We create transformative paths to healing and hope.